today in the news we are hearing a lot about HMPV virus. So HMPV is basically a common virus which has been there since many years, similar to COVID. But it is in symptoms and in other clinical aspects, it is similar to RSV or respiratory syncytial virus, which is a common virus which we see in infants and children. So what is the full form of HMPV? HMPV is human metapneumovirus. So it is a virus group which has been there since many years. So nowadays, because the virus has mutated, it is causing these symptoms. So what are the symptoms that we are seeing commonly is common cold-like symptoms. So basically it can cause cold, cough, sore throat, weakness, high-grade fevers. So when these symptoms are severe, so it can either cause severe bronchopneumonia, especially in children and in infants and in elderly population. So this virus commonly affects people with low immunity, that is infants, children and elderly age group, and people who have low immunity like people with cancers or CKDs. So right now the cases in India, number of cases are only 5, but whatever severity we are seeing, the cases are not that severe. So there is no need to worry, and we have to maintain certain precautions. So what are the precautions that we have to maintain? So like I said, whatever symptoms, whenever patient has these symptoms, we have to be careful. We have to immediately consult a nearby pediatrician or pulmonologist depending on the age group. And what are the precautions that we have to take? So the precautions that we have to take is, so frequent regular washing of hands, or you can sanitize your hands with sanitizer. Then we shouldn't touch our eyes and mouth and nose frequently with our hands. And we should maintain social distancing just like COVID, and we should stay away from sick people who have cold, cough. We should stay away. And if you have cold, cough and fever, so you have to not go to public places or crowded places. You have to stay at home and take precautionary measures or take treatment. So these are the precautions that we have to do. So what are the don'ts? What we shouldn't do? So we shouldn't reuse any tissues or handkerchiefs frequently. So we shouldn't come in contact with people who are already sick, or if you are sick, you shouldn't go to crowded places or public places. It is better to consult your doctor and take proper treatment. So HMPV right now is showing only mild cases in and around India, but there is no need for any concern or alarm. But yes, definitely we have to take precautions, we have to be careful. And if you have cold, cough, fever, sore throat, or if your children or if your elderly people have these symptoms, then please immediately get yourself tested and get your relatives tested and get the treatment done for it. So as of now, it is a variant of concern. You need not really worry about it, but we have to definitely take the precautions and follow the precautions which are being given by the government.